You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.
Welcome back to another episode of Plastic Surgery Uncensored. I'm super excited to have you. This is Dr. Roddy Raban. Today's episode is going to be called The Biggest Loser, and I'm so blessed to have Melinda, the Beauty Broker from New York City here with us. So make sure to tune in so you can hear what this is all about. I'm super excited about the content today. All right, so another episode of Plastic Surgery Uncensored with Dr. Roddy Raban and my dear friend Melinda, the Beauty Broker from New York City, who's also known as an aesthetic consultant and patient safety advocate. Did I say that right?
You said it right, Roddy.
I was like just trying to enunciate. And so Melinda and I are going to be doing a bunch of sessions together. And this one we have coined The Biggest Loser. And that has to do with the weight loss concept, which is a huge part of plastic surgery because obviously one of the things that leads to needing plastic surgery is weight loss, whether that is from diet and exercise, whether that is from the whole world of bariatric surgery that we have now, and also just from aging and the weight loss that occurs. So I think it's a really great topic. I think it's going to touch on a lot of things that people at home are going to be like thinking about. And as always with any topic we have, it's going to have some elements of controversy, right? Because it's only a topic worthy of discussing if there's questions to be had. Otherwise, it's just not very useful. So let's dive in here. Melinda, so what's your thoughts when you talk to patients and you're trying to guide them down the route of so-called weight loss, right? And excess skin. What are your thoughts?
So first, I just want to preface this with saying congratulations to every single listener who has gone through this journey and lost their weight, because I mean, God, how gratifying and how wonderful that is, and good for you.
Absolutely. It's a huge success.
It kills me when I get one of these clients who lost all of this weight and they're just like, okay, that's just that extra step. Now I need to get rid of all of this skin. And all of a sudden, lately, weird thing has been happening. A lot of these people are coming in saying, hey, you know what, Melinda, I was on Instagram and I read this thing about, for every 5 pounds lost, I need a syringe of filler in my face. What are your thoughts about that?
I mean, I just think that's in itself. Any formula is crazy. There's no formula for anything. There's barely even recipes for cakes. I think that's crazy. Listen, this is the deal. When you lose weight, let's forget about how. When one loses weight, the skin envelope slowly starts to deflate. When you're overweight, it's considered unattractive and you're out of balance. When you're underweight, it's considered unattractive and out of balance. What is the right weight? There is no right weight. Everybody's structure, skin type, frame is going to have or require a different weight. I have actually had patients come to me for body contouring who I've asked them to gain weight. The reason being is I feel like they've lost enough volume in their body that their skin doesn't have the nice turgor that it needs. Conversely, I've had patients that have come in that aren't weight loss patients that want something done, and I tell them you need to lose more weight for us to really get a home run result. Not to get a good result, but to get something like holy crap result. So in general, I don't really have any formula that filling for every amount of weight. There is no such thing. You look at the person and you say, wow, you know what? Now that you've lost 35 pounds, your midface is hollowed quite a bit, and now you're looking a little tired. Conversely, I've had patients lose 50 pounds and still have a very full face because they tend to lose it all in their abdomen. So how can you have a formula that one thing leads to the other? Generally speaking, the more weight you lose, the more loose skin you get. The more loose skin you get, the more of that skin you need to remove. That's a general gist.
Remove, tuck, lift. These are all things that, these are terms that we use with the weight loss patient. You don't really hear fill, unless, again, it's a mid-face volume deficiency. And I think at that point, they really should be seeing a facial plastic surgeon, and those are usually the type of surgeons who we do refer those patients to. But again, what is the right way to manage this patient who just went through this difficult journey of losing all of this weight and they just want a little bit of normal now? When someone comes to you and they need a tummy tuck, what's the first thing you look at, and how do you manage that, and how do you treatment plan for it, and how do you address it? And I know you and I had a discussion before where we were talking fleur-de-lis, no fleur-de-lis. What do you do with that skin?
So I like to do, I'm the way I think about things is I frame them. So the face and the body are completely different, and they're actually they almost go in different directions. So what happens is, if you'll notice, up until your late 20s, early 30s, you're blessed in that you can be super skinny and have a full face. But after 30, not everyone, and this is not categorical, but after 30, as you start to lose weight, you need to start picking. Do you want your body to look great, or do you want your face to look great? Because generally speaking, as you're in your 30s and 40s and you lose a lot of weight, your body may look good, but your face tends to hollow. And so there's degrees of things. So I look at the face. So let's just talk about the face a little bit.
Right.
So as you start to lose weight in your face and you're young and your skin quality is pretty good, you may actually need just a touch of volume to replenish the areas that you've hollowed. And classically, that would be in the middle of your face, the cheeks. You start to hollow under your eyes. I was doing triathlons. I was hyperthyroid. I had gotten 150 pounds. I was ripped. I was 8% body fat. Not a day would go by where people were like, "Are you okay? Are you feeling all right? Are you sure everything's okay?" I mean, I look like, God forbid, a cancer patient because I lost so much volume in my face. I gained all that weight back, and I was like, "You look so amazing." Yet I felt I felt disgusting because I obviously had a little belly. So when it comes to the face, initially you're going to need a little volume.
And do you do that with hyaluronic acid filler? Do you do that with microfat, nanofat? What is your preference?
So when it's volume, then you need to exactly that. You need to say what kind of volume you want to use. Do you want to use filler? Do you want to use autogenous or real live fat? It depends. I think fillers, when done correctly, when the right filler is selected for the right area, you can get an amazing result. Benefits of the filler, right? You walk in, you open a syringe, you inject, you have a really good result, you go about your business. Downtime, very small, easy to do. Great. Downside, can be expensive. You got to keep doing it because it will go away. The key is, like, you don't put Voluma under the eye. You and I talked about that. I had a lady that came in and she had Voluma is like putting, I don't know, like some
Cement.
concrete cement in your as the flooring for your bed. Like, it just doesn't belong there. So I love fillers, and fat works really good, but I like fat when I'm doing it in conjunction to surgery, right? Because it's a procedure. So you're there, you're getting a facelift, you're getting your eyelids done, you're getting a rhinoplasty. I think getting a little bit of microfat or nanofat is very reasonable. So as you lose more weight, you can't just fill it away. You can't make the excess skin in your neck go away or the marionettes go away. And that's the dangerous part. Then you need to switch to another tool. You gotta remove the excess skin. You gotta resuspend the muscle layer. You gotta take out the fat and redistribute it, and you gotta tighten up the muscle bands. So the face, it's, again, as you had said many times, it's not a one size fits all. It isn't like you lose weight, you gotta fill it. You lose weight, you gotta cut it.
Right.
No, you gotta.
That was a very broad statement, when I had read it. So I was like, oh God, one syringe for every 5 pounds, like, this just makes no sense. And that's such a broad statement. That's so misleading. And, the wrong person who reads that is going to think that. And every time they lose 5 pounds, they're going to go put more filler in their face.
Right.
It's
That's
crazy.
all marketing, right?
Yeah.
What kind of statement is that? That's a marketing statement. That's like a brand kind of a thing. Like got milk, right? You say that. So now you're like, oh, I've heard that before. So it's like every 5 pounds is one syringe. It's a gimmick. Because we both know that that's impossible. Now, to answer your question, when it comes to the abdomen or the body, it's a totally different situation. You keep losing weight. So when you start to lose a little weight, you're going to get into this sort of what I call the danger zone. Because you haven't lost enough weight where you have loose skin, but you still have some fat. If you remove the fat that's still there, you're going to get more loose skin, right? Mm-hmm. And if you cut something out and you haven't lost enough fat, you're going to get a bunch of scars for no reason.
Right.
So you want to pick where you want to be. You either want to stay full and just stay the way you are, or you want to get to a point where you're super healthy and you've lost all your weight and you can maintain it. Then you're going to need to have that excess skin removed. If it's in your breast, you're going to need a breast lift. So many patients need an implant. Mm-hmm. Well, what do I need an implant for? You need an implant because you have no volume, because you've lost a ton of volume in your breast. And breasts are volumetric structures, right? So you need some kind of volume. And then the abdomen, we talked about it. It's what I call it. It's tailoring. So if you take that beautiful jacket you have and you decide to lose 10 pounds, you may need to just take it in through one seam, just the back. If you lose 40 pounds, they can't take it through one seam, can they? They got to open up both side seams. You lose 100 pounds, now they got to open up every seam because your arms don't fit, the shoulders don't fit. And so...
Got to just get a whole brand new jacket at that point.
Yes, you would get a brand new jacket, but you cannot get a brand new body.
That's right.
So that would be a mini lift, a mini body, a mini tuck, a full tummy tuck, an extended tummy tuck, a 2/3 body lift, and a circumferential body lift. So I think that's a very, very good question that you asked.
So circumferential lipectomies versus tummy tuck versus fleur-de-lis versus what other type of procedures or techniques do you use, and when to decipher between those? Again, for the person who lost too much or needs, one seam or two seams or three seams, what is your take? I see a lot of people just do the tummy tuck without doing the circumferential.
Right. And you know why that is?
Why is that?
Because it's a pain in the ass and it requires a certain skill set.
Right.
And you got to turn the patient at least twice, if not 3 times the way I do it. And it's easier just to say, hey, a tummy tuck will do. So you tighten up the front of the abdomen, the sides of your hip and around the back stay fluffy and extra skin. It actually looks worse than it did before because now there's a propagation effect, which means where there's a transition between the snug, nice, tight abdomen and the transition around the hip actually looks more exaggerated. And then they tell you to come back another day and they'll do the back. And that's just because, again, like what we talked about before, you happen to only have a hammer in your toolkit, and this one required a screwdriver. Mm-hmm. And instead of saying, hey, you know what? This is just not for me. You've lost too much weight. You really do need to see someone who does a body lift. You just figure out a way to hammer in the screw.
And most of these cases need to be staged. I think a lot of clients come to me, they're like, I just want to do it all at once. And you just possibly can. And what are the risks of trying to do, or overdo a lot of these surgeries for the weight loss patients? Talk to us about that.
So the body contouring thing, what I tell them is, let's create a wish list. And I always use this concept. I said, let's say you have no more money except for one surgery. What bothers you the most? Most will say their trunk. Some people say their arms. And I say, okay, then next, and we create a list. Since I do my body contouring alone, which is unusual. Most people have a bunch of people. So like there's a junior, someone who helps close, the tech closes, you tag team these things like NASCAR. You can do more procedures. You do them shitty, but you do more of them. So patients really love to hear that. You mean I can do my body lift, my breast lift, and my arms? Oh, that's amazing. Well, how the F is that possible?
One side will look good, the other side looks different.
Right.
Why? Why is that?
Yeah. So you're right. We stage it. And I tell them, listen, I can only do your body lift. That's the grand poobah. That takes me 7 hours. Once you're done with that, 2, 3, 6, 9 months later, we'll do your arms, then your thighs, and so on and so forth. So you definitely have to ask, if everything is done at one time, there's no way they can all be done well and they can be done at the same quality. You know what I mean?
And sometimes too much surgery creates blood supply issues. And could you talk to them a little bit about this?
Yeah, so necrosis. That's a very good point. We talk. I'm sure you've had clients who've had procedures done, and then now they're calling you, and they're like, "Oh my God, certain areas turn black."
Well, I've seen a lot of issues or patients who have come to me, after the fact, and they're botched. They've had the tummy tuck and extensive liposuction to the midsection. So, I've spoken to a bunch of surgeons about this who said, you don't want to do too much liposuction to the midsection at the same time as a tummy tuck because it compromises the blood supply.
How about never?
Never.
How about never? Not a lot. How about never?
Right, and you see so many people doing it though.
I have never ever liposuction. So let's understand. First of all, the idea of getting a tummy tuck and liposuction is almost an automatic. In other words, it's like you can't walk into your car dealership and not get the upgraded, sunroof. But I don't need sun. I had melanoma. You need the sunroof. Trust me. So everyone thinks that if they need a tummy tuck, they automatically need lipo. So if you go onto my gallery, for example, 15% of the patients, 1.5, have had liposuction. That means 85% of my patients never got liposuction with body contouring. So, well, how do you get a waist? They told me I can't get a waist. You get a waist from the diastasis. You get a waist from the abdominal musculature work. Just like a facelift looks beautiful when you tighten the muscles, not when you pull the skin. Mm-hmm. So that's number one. Secondly, the problem is that people do a lot of aggressive liposuction today. They have all these aggressive tools and they take fat and they put it in the butt and then they take it out of the thighs and the flanks and then whatever. So when you liposuction an abdominal flap, you lift it up and then you suck out all the fat because you want that flap to be thinner. You're compromising the blood supply in that flap. And then you tie it tight and then you and then you have the patient stand, well, of course a part of it is going to die or get dark and not make it. So I never liposuction the abdomen simultaneously. I may, 15% of the time, liposuction the love handles, which has nothing to do with the abdomen, but even that I do sparingly, because if you've lost enough skin where your belly's floppy, your love handles are floppy too.
For sure.
And when you liposuction a floppy love handle, which is full, and then you need a body lift, because now the fat is gone, great, awesome, and now that skin that was crappy is really crappy.
Right.
So anyways.
And what are your thoughts on, because here's another controversial topic when it comes to abdominoplasty, floating the belly button because for the sake of the patient keeping their own belly button?
Awesome. We're going to take a break because I do want to talk about that. I think because you have experience in consulting people, you know all these little nuances that patients have. People are floating the belly button. What the hell does that mean? Fleur-de-lis. What is that word? These are all buzzwords, but these are the things that you need to know that if you don't do your homework, you can't figure out. So we'll talk about floating the belly button because I'm really passionate about that.
Okay, great.
Stay tuned. We'll be right back with Plastic Surgery Uncensored.
You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.
All right, welcome back to Plastic Surgery Uncensored. I'm Dr. Roddy Raban here with Melinda, our fantastic beauty broker from New York City. And we just left talking about some of the nuances, this is what I refer to nuances to patients, of an abdominoplasty or body contouring. Remember, in order to go from good results to great results, there must be some nuances, just like amazing hair, amazing paintings, amazing interior decorating. It's about the nuances. And so what is it about body contouring that makes it amazing? So one area that is so crucial is belly buttons because, you could be at a poolside and even if the doctor did a crappy job and the scar looks like dog meat and it's super high, you can cover it up with a midriff bathing suit, which happens to be in fashion now. Hopefully for those people whose scars are high, it stays in fashion. But the belly button is never going to be hidden unless you wear one piece. Well, if you're going to wear one piece, you almost didn't even need to do this. So everyone knows that the belly button's crucial, and there are usually hideous. You go online and you look, and you're like, sundial. We have a gallery here on an iPad, and I collect them like people collect things, and I take photos of ugly belly buttons so we can show the patients what's possible.
And there's many ugly belly buttons
So
out there.
let me tell you a little about belly buttons. First and foremost, what makes a belly button attractive, you need to know before you try to make a new belly button. So when we do an abdominoplasty or tummy tuck, what you do is you cut around the belly button. You leave that belly button attached to your abdomen. It's not moved. It's not translocated. It's not cut off. You don't make a new one. It's your belly button stock attached to your abdomen. Just a circle around it where it's attached to the skin is separated. The surgeon will lift up the skin, including the hole, and go all the way up to the top of your ribs. And now they will be looking at your abdominal wall and your abdominal muscles. Most patients, 85% of them, will have some kind of muscle separation known as diastasis. Mild, moderate, and super severe. The doctor will repair that diastasis, sew it together, and if they do a good job, you're going to be super flat and tight and have much less back pain, because back pain is what happens when you have diastasis. Or if they do a crappy job, you'll have still a puffy belly, or worse, they'll do a tighter job on the bottom than the top, and then you get this sort of S-curve. There's a lot of contorting and weird things that happen. Then they take the excess skin and bring it down, cut off the excess skin, close that, sew it together, and then make a new opening from which the old belly button, exactly where it was, comes on out. If your belly button's to the left a little bit or to the right a little bit, which most people's are not in the midline, it's going to be exactly there. Then they create a hybrid, a reconstruction. They literally take your existing belly button and bring it out of a new opening. How that is reconstructed will determine whether or not you're in a bikini, drinking a pina colada, in Cabo, or you're wearing a complete one piece because you're ashamed of your belly button. But you would think that's simple, but it's not. When you were pregnant or 250 pounds, your belly button was all the way out to here. And then you lost all that weight and your abdominal skin is loose. So what does that mean about your belly button? It's loose. It's long. So you need to truncate the belly button and sew it back down and make it nice and snug in your abdominal wall where it was when you were 16. Tight stock. Then you make a much smaller opening than you think because that thing stretches. And then you force that opening down into the hole and it's going to look tethered and puckered. That looks like an athletic, attractive belly button. Conversely, if you just cut a big hole and pull it out and leave it long and sew it on, it looks like a sticker. So the belly button is super important. Now, there are a subset of patients. I call them Malibu moms. They usually only had 2 kids. They usually were super fit. They usually have enough loose skin and enough diastasis that it drives them crazy, but not enough loose skin or diastasis to be a slam dunk tummy tuck. There's a lot of these patients, and they usually end up doing some cockamamie procedure because they're not an obvious tummy tuck. They go get a bunch of liposuction of their abdomen. Boatload of loose skin, diastasis looks worse. They go and do a tummy tuck, and they don't have enough skin to take that hole out. And so what they do is this thing called a floating belly button. They literally, the doctor will cut the belly button as if it were a mole or something attached to the skin and bring it down with the skin. The craziest thing ever. First of all, your belly button will be super low, like ridiculous low. Second of all, it will no longer be attached and puckered, even though they sew it. And then you'll never be able to ever do that procedure again because your belly button's now detached. The right answer is to just ignore the little hole, move the excess skin according to what it needs to, and just close it like you had a laparoscopic tubal ligation, and it's a tiny little dart. And people will go on the gallery and they're like, "Oh, Dr. Brown, I noticed you have these little lines here and there, and these are early."
That's the old belly button.
That's where the old belly button was. But you know what the crucial thing is? The scar is super, super low. Your scar should be in your groin where a C-section was. So the pet peeves are, number 1, ugly belly buttons. Number 2, high riding scars. So scars are really high. So you did all this and now you'll look at it before and after. I always say, you want to know where the scar is? Look at where the underwear is. No woman, no matter how shy or modest she is, wears her underwear an inch away from her belly button. That's because the scar is too high. The scar shouldn't run straight across your hip because you create dog ears on the thigh. There's no abdomen on the thigh. It needs to curve along your pelvis. If you have a sharp pelvis and a very deep pelvis, then it rides high. If you have a shallow pelvis, it rides shallow. And the last thing is this whole liposuction of the love handles and what you need, because every patient initially will argue with me about this liposuction. If you have thick, high-quality love handles with thick skin and you have some excess, absolutely we can liposuction. But if you have loose skin and you have some fullness, if I get rid of that fullness, you're going to get more skin, and then you're going to come back probably 6 months later and need that skin removed. So that's sort of my belly button tummy tuck pearls.
Okay. Well, I respect that. As far as the patient who comes in with just loose skin, but they're very thin, there's no fat, there's not enough skin to tuck or cut or do a brachioplasty or do a tummy tuck or thigh lift. What do you do with those patients? A lot of them come in middle-aged, in their 50s, menopause is rearing its ugly head, and they're just like, Melinda, but the skin on my body is just thin and crepey. What do I do about the skin on my body? And I tend to look at those people and say, we have to look at nutrition. We have to look at hormones. We have to look at your bloods. This is kind of like more endocrinology or hormone specialist or nutritionist. What do you do with those patients? So
if you have no excess skin, but you just have poor quality skin, I don't know that there's a lot to do. It's $1 trillion business. People would put creams,
right.
serums, lasers, hormone replacement, pellets, etc., etc. Everyone that knows me knows that I'm science-based. So I like to do things that have evidence and some proof. So I don't do hormone replacements. I don't do a lot of the things that are being done. I don't have a bunch of machines and RF lasers and radio frequency, this and that, the other. I find the results of the majority of these body tightening devices at best mediocre to terrible. They're very expensive. And invariably what I found is they do more damage because they're heat driven. And the little bit of fat they have underneath is so sensitive to the heat that somehow it doesn't look much better. So until someone can scientifically tell me that something works, I tell those patients that unfortunately there's not a lot I can offer them. The problem is they're so vulnerable and they're so unhappy that they're willing, despite the fact that they know very well that there's no proof, go and be subject to being a guinea pig for some of these other facilities. That's where these med spas make millions of dollars. Med spas make millions of dollars on vulnerable patients trying to get rid of cellulite, no proof. Stretch marks, no proof. Scars, no proof. Crepey skin, no proof. Right there is a $1 trillion business, and they're revolving in and out.
Right, because these people come to me, they're like, there has to be a solution for stretch marks. There has to be a solution for scars. There has to be a solution for the cellulite. The cellulite, I'm like, you could mask the cellulite with a little bit of Sculptra, but as far as the stretch marks or the scars, like usually they need to be cut out. This comes down to like good old fashioned plastic surgery. Things need to be cut out because there really is no solution for tears in the skin or, a poorly closed or sutured incision that your old tummy tuck doctor did for you, your hypertrophic scarring.
You got to cut that scar out, close it again, and it'll close well.
But
the doctor told me
laser.
that I make bad scars. The doctor said you make bad scars because the doctor did a shitty job, closed you crappy, it was under tension, too much skin was removed, it was a poorly closed layer, there wasn't many sutures put in, blah, blah, blah. And another thing that you and I talked about was this idea of trainer versus surgeon, right?
Personal trainer versus surgeon.
Right? So when do I need to lose weight and when do I need to see a doctor? So again, this goes back to the integrity of each surgeon. So I see patients and they kind of fall into 3 categories. Patient comes in, they've lost sufficient weight. This is all referring to body contouring. They've lost enough weight, they have loose skin, everything looks amazing. They're a home run in terms of their readiness, their candidacy. Awesome. I see patients that come in and they are not even close. They're overweight. They have some loose skin, but they're like, as far as I'm concerned, 50 pounds away. That patient needs to, with love, with a little bit of tough love, with compassion, be told, listen, you're almost there, but you got to keep going. And you got to lose the weight. Otherwise, you will have a terrible outcome. For example, you can remove the skin, but then you can't flatten the abdomen. So what do they look like? If you come in and you have intra-abdominal fat, meaning you carry a lot of fat inside your abdomen, and I do a body contouring procedure on you, like a tummy tuck, and I remove the little bit of hanging skin from your pubic area, what will you look like? A barrel. You will look like a barrel. You will be a tight barrel. Skin's gone, no more loose skin, but you now have a round, tight abdomen because you can't push that abdomen in. The key is the middle section of patients. The middle section of patients are patients who have lost sufficient weight. They could have a tummy tuck. They could have a tummy tuck, and they will get a good result. But 5, 10 more pounds, and they will have a great result.
Right.
Good to great. So I tell them straight out, I can do your surgery. You want to do your surgery in a month or 2, or you can lose 10 pounds. If you lose 10 pounds, I guarantee you I'm going to knock this out of the park. But what is that 10 pounds doing? It's the intra-abdominal fat. It's the fat that I can't get rid of. It's the flattening of your abdomen. It's the tight look that you look online and you're like, wow, I look so good.
Right. A lot of people don't take that intra-abdominal fat into consideration because they don't realize that fat can exist there.
Very true. And people think like they'll pinch their abdomen, like, look at how much
fat
fat
all this fat you could
I'm
take.
like, yeah, that's not relevant. That's not the fat we're talking about. It's the fat. Now, luckily for women, listen up, guys. Luckily for women, it's not as common for them to have as much intra-abdominal fat. They tend to carry it in their thighs, and that's why we say women are pears and men are apple. I have men all the time coming for tummy tucks, and almost invariably none of them are candidates. Almost never, because they carry 85% of their fat intra-abdominal, and there's nothing to cut. They just need to lose the weight. Right. Women, though, definitely come in, and so you got to be definitely aware that you got to lose that fat before you're a really good candidate.
Right, men who come in with those big, hard, full bellies.
Yeah,
I see them all the time.
Just send them out.
I'm like, talk to a trainer, please.
Cerveza.
And complications with the weight loss patient as far as skin integrity. And I hear a lot of patients say, oh, because I scar so poorly, and you touched upon this already, but these poor weight loss patients, they shouldn't have horrific scars all over their body. A lot of doctors will tell them, oh, it's because you're really, really poor skin laxity. Your skin is not in the best condition. And I mean, there is a little bit of truth to that, but I don't think they should be walking around looking like Frankenstein either. No.
As a matter of fact, this is the irony. So first and foremost, let's talk about complications for these weight loss patients. When you're dealing with someone who's lost, let's use extremes because it's easier to talk, 100 pounds, they're going to have a lot of loose, crepey skin, and that skin's going to have lost its elasticity. Having said that, that doesn't mean that they are they should be having complications. In the 15 years that I've been practicing, I've done a ton of body contouring. I've never had necrosis where I've lost some major part of an abdomen. When you're dealing with someone who's got a lot of loose, crepey skin, you need to treat it with a little bit more delicacy. You can't be rough with it. You can't pull it extra tight and remove way too much. When you close it, you have to close it in multiple layers, and you need to be a little bit more careful. In regards to scar, it's ironic, but this is how it is. The thinner and crappier your skin is, listen carefully, the better scar you make. So I'm going to say it one more time, and then I'm going to explain it to you. The thinner and crappier your skin is, the better scar you make. So who has thin, crappy skin? As we get very old, so you see people come in for Mohs surgery, they have a huge cancer removed from their face. I have a book in my office. I can reconstruct that, and you'll be like, oh my God, where is that scar? Mm-hmm. A 4-year-old child gets bit by a dog on their cheek. I'll sew them up. They'll have a visible scar for 8 years. The reason being is when the skin is high quality, it has a lot of collagen in the dermis, a lot of elastic, high integrity components. So when it's healing, it's going to heal really well. It's going to make a boatload of scar. That's why Asian patients and African American patients who have incredibly good oily skin tend to make not as good a scar as people who are white and have thinner skin. So people who have less collagen in their skin, people that are older or have lost weight, tend to make thinner, flatter scars because their body can't generate the overproduction of collagen, which is known as hypertrophic scars. So it's all actually the less likely to get it when the reason they get shitty scars when you're weight loss patients is because those surgeries are done with the reconstructive glasses on of your surgeon. What does that mean? They don't give a shit what it looks like. They know that if they remove the majority of the skin, you'll be stoked. You'll be happy. You don't have the same level of scrutiny that a 19-year-old girl who is coming in for her nose does. You come in with all this loose skin on your arms and your thighs and your abdomen. We get 3 people. We all jump in. We all remove it. We close it. It's good enough. Yeah, they don't exactly look the same, but you know what? You look way better, and that should be good enough.
Right. And that's always what you hear. That's the conversation that you hear with these patients. And the patients are like, okay, because again, they're in such a vulnerable position.
Absolutely.
So they're like, you're right. I guess it was a lot of skin. And sometimes I'll take a look at them and I'm like, no, this is wrong. Whoever you went to really did you a huge disservice because this should have looked so much better.
100%. As a matter of fact, you're some of the most incredibly gratifying patients because you're like, wow, my God, I can't wait. You're going to look so good.
Yeah.
Because from a surgeon standpoint, the transformative power is unbelievable because you know that once that skin's removed, underneath there is an incredible body.
That's right.
So I usually get super excited. So I'm to all the patients who've lost a ton of weight, as you said on the opener, congratulations. I know that the journey seems like it's not complete, but with a little bit of homework, saving a little bit of money, you can really get to the finish line in such an incredible way.
Keep on trucking.
Yeah. So this was a really great section. The Biggest Loser was referring to people losing the weight. We look forward to having another segment with you. Thank you for tuning in to Plastic Surgery Uncensored. Remember to tell all your friends, share it, subscribe, and download. Not just subscribe, but download.
We would love to get your feedback. If you enjoyed and found our podcast helpful, tell us why. Give us a review and subscribe on your favorite podcast platform. We can be found on Apple Podcasts, Google Podcasts, Spotify, iHeart, or you can go directly to revolverpodcast.com. If you have a topic you would like us to talk about, then please reach out to us on Facebook, Roddy Raban, Instagram at Dr. Roddy Raban, or RoddyRaban.com. You are listening to Plastic Surgery Uncensored with Dr. Roddy Raban on Revolver Podcast.